Hi, my name's Aviva. I'm here to show you the 3 steps needed to measure and take Pheburane, including the 2 different ways you can take Pheburane. Before taking Pheburane, you'll need to determine your mealtime dose to take every time you eat. If you eat 5 times a day, including meals and snacks, then divide your total daily dose by 5 to get your mealtime dose. As an example, if your total daily dose is 20 grams of sodium phenylbutyrate, and you eat 5 times a day, you need to measure and take 4 grams using the calibrated Pheburane dosing spoon each time you eat. There are 3 steps to measure and take Pheburane. Let's say for this example, your mealtime dose is 4 grams. The spoon measures up to 3 grams in 0.25 gram increments. So you would take the spoon, fill it up to the 3 gram line, take that, then fill it up to the 1 gram line, take that to get your full mealtime dose. I've marked the spoon with black permanent marker on these lines to make it easier to see the dose. Step 1 is to pour and measure the dose. You must use the Pheburane calibrated dosing spoon to measure your Pheburane dose. It's calibrated to ensure you take the right amount of sodium phenylbutyrate. Here's a tip on how to pour Pheburane. Pour the Pheburane into the tube section where it meets the edge of the spoon. It's best to have the Pheburane bottle right at this spot on the spoon and with a slight angle. If cleaning is necessary, rinse the spoon with water and dry it completely. It can pour out quickly from the bottle, so be careful to pour slowly. Practice pouring a few times and you should get a good feel for how to pour and how much to pour into the spoon for the dose. Step 2 is to tap the spoon on a flat surface like this table to get an even level. Add or pour back Pheburane as needed to get your prescribed dose. Tap each time to check the dose level. Once you have the correct dose, then on to step 3, take Pheburane. There are actually 2 ways you can take Pheburane. You can take Pheburane by swallowing it with a drink, or you can sprinkle it into soft food before taking, and then follow the dose by finishing your meal or snack. Here's the first way you can take Pheburane. You can either take the entire dose in your spoon all at once, or you can take a little bit at a time. Let me show you taking a little bit at a time of this 3 gram dose. So now I've demonstrated how to take part of the mealtime dose. Repeat these 3 steps to take the rest of the mealtime dose. In this example, 1 more gram is needed. I will demonstrate taking this 1 gram all at once. It's important to swallow right away within 10 seconds before the taste mask coating begins to dissolve. This is Jack. He's 7 years old. He's going to help me demonstrate the second way to take Pheburane. In this example, he takes 10 grams of sodium phenylbutyrate a day. He eats 5 times a day, so the mealtime dose is 2 grams. You can sprinkle Pheburane onto either applesauce or carrot puree right before taking. Some children may prefer this method, or your child can take the dose from the spoon like I previously demonstrated. So, let's pour and measure the dose. Then give your child this spoonful. Pheburane is taste mask, so your child should not notice the taste. Once your child has taken that, continue until the rest of the mealtime dose has been taken, and then follow by having your child finish his meal or snack. It's important to swallow right away within 10 seconds before the taste mask coating begins to dissolve. Indication and important safety information. What is Pheburane? Pheburane is a prescription medicine used along with a specific diet for the long-term management of adults and children with urea cycle disorders, UCDs, involving deficiencies of carbamyl phosphate synthetase, CPS, ornithine transcarbamylase, OTC, or isogninosuccinate synthetase, AS. Episodes of sudden rapid increase of ammonia in the blood, acute hyperammonemia, may happen in people during treatment with Pheburane. Pheburane is not used for the treatment of acute hyperammonemia, which can be life-threatening and requires emergency medical treatment. Before taking Pheburane, tell your healthcare provider about all of your medical conditions, including if you have heart problems, have kidney or liver problems, have diabetes, Pheburane contains sucrose, or have a history of fructose intolerance, glucose-galactose malabsorption, or sucrose-isomaltase insufficiency, are pregnant or plan to become pregnant. It is not known if Pheburane will harm your unborn baby. Are breastfeeding or plan to breastfeed. It is not known if Pheburane passes into your breast milk. Talk to your healthcare provider about the best way to feed your baby during treatment with Pheburane. Tell your healthcare provider about all the medicines you or your child take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. Certain medicines may increase the level of ammonia in your blood or cause serious side effects when taken during treatment with Pheburane. Especially tell your healthcare provider if you or your child take corticosteroids, valproic acid, haloperidol, or probenecid. Know the medicines you take. Keep a list of them to show your or your child's healthcare provider and pharmacist when you get a new medicine. What are the possible side effects of Pheburane? Pheburane can cause serious side effects including nervous system problems, neurotoxicity. Call your healthcare provider right away if you get any of the following symptoms during treatment with Pheburane: sleepiness, tiredness, lightheadedness, vomiting, nausea, headache, confusion. Low potassium levels in your blood, hypokalemia. Your healthcare provider will monitor your blood potassium levels during treatment with Pheburane and treat if needed. Conditions related to swelling, edema. Pheburane contains salt, sodium, which can cause swelling from salt and water retention. Your healthcare provider will decide if Pheburane is right for you if you have certain medical conditions that can cause swelling, such as heart failure, liver problems, or kidney problems. The most common side effects of Pheburane include absent or irregular menstrual periods, decreased appetite, body odor, bad taste, or avoiding foods that you ate prior to getting sick, taste aversion. Your healthcare provider may do certain blood tests to check you or your child for side effects during treatment with Pheburane. These are not all the possible side effects of Pheburane. Call your doctor for medical advice about side effects. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. Please read the full prescribing information and patient information at Pheburane.com.